The major challenge is the use of this SPH electrical solver to obtain the different patterns in the porcine hertz. Basically, it's a code written in C++ without interface that makes very difficult the adaptation to what is required for the TFG, since I have to work on the code and it's quite extensive.
I think the main challenge has been to get immersed into a topic that I've never worked with it before in such a deep level, but now I am seeing that it's quite interesting and I want to keep on studying it.
The major challenge that I have faced during my bachelor thesis was to learn and understand about the different nanoparticles and the derivative pathways of the polyplexes we were using. Furthermore, it's been challenging learning about several different techniques to analyze and obtain the data, such as flow cytometry and the dynamic light scattering.
What I did in this TFG is to look for a clinical application for a technology that is under development at the laboratory. For that, I needed to interview a lot of healthcare professionals, and also I had to explain how this technology would operate, because they are the ones who would be prescribing it. So I had to explain all the electronics behind this medical device, how it recollects the data, how it is going to process it, how is it going to behave inside the patient's body. So that was a big challenge, because I was asked a lot of questions and often I didn't even have the answer for them yet. So that was a big challenge, to explain all the electronics to them, but also to try to convince them that this was a good solution for them, that it would help improve the quality of life of their patients, but could also help them in their daily practice.
So in my bachelor's thesis, I apply a series of processing steps to the recordings of electroencephalographies of epilepsy patients in order to extract certain pieces of information from it. The biggest challenge that I have found is that it is very, very easy to lose track of what every processing step actually means at the very biological level. It is very important to know what we're actually doing with every transformation that we apply to the data in order to make sense of the results and be able to interpret them correctly.
The major challenge has been to gain a deep understanding on how the current hospital circuits for surgical procedures works and which protocols are currently being used when performing surgical procedures outside the operating room.